各位觀眾大家好，歡迎收睇26分鐘見證實錄。聯邦政府喺2022年根據受管制藥物及物質法，允許卑詩省喺去年1月開始唔會拘捕或者起訴藏有2.5克供個人使用嘅藥物嘅成年人。呢項豁免期為期3年，希望令到吸毒者早日遠離毒品，拯救生命。政策實施已經1年啦，但係因為吸毒過量而死嘅人未有顯著下降。政策嘅成效令人關注。根據卑詩法醫服務處嘅資料就顯示去年平均每個月因為吸毒過量而死亡嘅人數超過150人。當局對於呢一個數據又有啲乜嘅解釋呢？
We have no power. We have zero power. This influence, it's actually, when we keep talking about the government, people sometimes say, we can't expect the government to do it all. We don't, but the government is the only one that has the power to make the changes.
Oh, I think it's been very, very bad, to be honest with you. We warned that it was going to be very bad because the government recklessly put forward this decriminalization of hard drugs like heroin and cocaine and methamphetamine and fentanyl without having any protections in place. There's no education in our school system to make sure our kids know that decriminalization does not mean that drugs are safe. They're very dangerous.
卑詩省毒品非刑事化政策推出超過1年，不過吸食過量毒品而死亡嘅人仍然高企。政策成效令人質疑，省政府對毒品問題上係咪束手無策呢？卑詩省府2016年宣布毒品危機進入省醫療緊急狀態之後，至今已經超過13200人吸毒過量而死亡。為咗減低死亡風險，聯邦政府喺2022年宣布允許卑詩省喺舊年1月開始豁免拘捕或者起訴藏有2.5克供個人使用嘅藥物嘅成年人，豁免期為期3年。但根據卑詩法醫服務處數字顯示，喺2023年每個月因為吸毒過量而死亡嘅人數就冇顯著嘅下降。政策成效係咪同當局原先推行嘅初心一致呢？
We have a terrible scourge. The illicit drug supply is so poisoned, it's so compromised that 85% of people who have died, 85% of their toxic their drug screens come back as their supply having been contaminated with fentanyl. There's fentanyl. There's other things like carfentanil. Other drugs that are extremely toxic, extremely powerful, and that are very unpredictable. So that toxic drug supply is extremely unpredictable, extremely volatile. We also are seeing increasingly benzodiazepines in the drug supply, and benzodiazepines can't be reversed with naloxone. So that's a problem. And we're also seeing other contaminants in the illicit drug supply. So as fast as we are trying to adapt our ways of reaching out to people and ways of trying to connect them to help, the drug supply is changing also very quickly. And it is because of synthetic opioids. It is a very, very challenging situation, very challenging for law enforcement. I mean, our law enforcement are engaging in, I read about drug busts every week in the newspaper. I mean, the law enforcement are going after predatory drug dealers for sure.
卑詩聯合黨黨領馮爾剛形容呢一項等同將毒品非刑事化政策係失敗嘅例子。佢又話政策加劇公共安全問題。
Oh, I think it's been very, very bad, to be honest with you. We warned that it was going to be very bad because the government recklessly put forward this decriminalization of hard drugs like heroin and cocaine and methamphetamine and fentanyl without having any protections in place. There's no education in our school system to make sure our kids know that decriminalization does not mean that drugs are safe. They're very dangerous. They put no restrictions on open drug use so that people were using drugs in parks and playgrounds and beaches and schools. And only recently have they brought in some legislation now, much too late, frankly. And we've seen increased violence in our streets, and including, unfortunately, sadly, a police officer that was shot to death in a drug raid. So I think this has been a terrible policy for the community.
為咗釋除公眾疑慮，卑詩省府分別喺舊年9月同埋10月獲得聯邦政府批准修訂相關條例，禁止任何人喺遊樂場、嬉水池同埋滑板場等等嘅遊樂設施15米範圍之內管有非法藥物。另外，亦都禁止喺包括企業同埋住宅大樓等等嘅建築物出入口、車站6米範圍之內同埋海灘等休憩場所使用非法藥物。有團體形容呢一個係大倒退。
So the new legislation that the British Columbia government introduced bans the use of drugs in public, which is slightly different because the original legislation in February just allows you to possess the drugs. It allows you to not have criminal charges because you have the drugs on you. The new legislation means you cannot use them in public. There's a big concerns with that. Right now, because the drug supply is so incredibly toxic and dangerous, 21 people die every day in Canada because of toxic drugs. The safest place may be to be in public because someone is there, they can see and they can respond to you. This law would mean that you are now criminalized from using in public, and you may be forced to go under a bridge or into an alleyway or hide in a stairwell where no one will see you. There's another question, though. Why are people using drugs in public in the first place? And that has to do not because of the drugs, but because we have a housing crisis. We don't have houses. People are homeless. And the only place they can use is in public. So that speaks to the issues of a housing crisis and the issues of some of the harm reduction programs. So we have places where people can go use injection sites. They are not being resourced. They are not at the scale they need to be to help people move out of public spaces and use in safest places.
有社福界人士話，新規例將會令到卑詩省社工喺冇任何支援嘅情況底下負擔加重。
BC social workers are involved in this issue from the street level, where we have social workers working out on the street and through the back alleys and down by the riverbanks and trying to keep people safe and direct them to services and so forth. But we also have social workers working in detox, treatment, support services across the province. And the reality is that we just haven't seen a reduction in the number of deaths that are caused by poison-laced illicit drugs. And that really is the bottom line for social workers, where we are continually advocating for safe supply. We got it that there are a lot of people that struggle with this concept, but I think in order to ensure that people get into treatment, get into detox, get into treatment, we have to first keep them alive. That's the first step that we need to take. And every day in British Columbia, 6 or more people are dying from laced illicit drugs. And that's just not right.
最近亦都有醫護團體對省府呢一項禁止喺指定公眾範圍使用毒品嘅新法例提出法律挑戰。喺舊年年底，卑詩最高法院頒下臨時禁制令，限制政府法例直到今年3月31號期間不得實施。卑詩精神健康及僻孕廳長韋瑞珍 Jennifer Webster 就話：事實係毒品成癮問題已經困擾卑詩省10幾年，省政府必須用盡一切可行嘅辦法，減少吸毒者被污名化同埋省民面對嘅恐懼。
We're in a public health crisis that has taken the lives of over 13,100 British Columbians since 2016, and more since 2012, if we go back and count for 10 years. We are losing, thousands of British Columbians every year. It is critical that we act on all of these fronts, that we have access to, that people have access to that we can separate people from the illicit drug supply, that we can provide them with pharmaceutical alternatives to the illicit supply, that we can hold them and keep them alive until we can connect them to care and to treatment. We are building more beds, expanding access to treatment services more than we ever have in this province. And That is the work that we have to focus on. And we have to reduce the stigma and the fear that people experience because of their addiction. You know, people who have other chronic health conditions, you know, don't experience the same kind of fear of reaching out for help. They don't experience the same kind of stigma when they go and try and access the healthcare system.
舊年11月，卑斯法醫服務處死亡檢討小組喺持續危機緊急應變嘅報告入邊指出，防止更多吸毒過量死亡有迫切性，而最快嘅方法係減少依賴街頭毒品嘅供應。報告建議向聯邦申請豁免處方更多類別毒品，容許民間機構申請並且派發非處方毒品。不過，精神健康及癖癮廳長韋瑞珍發信立即拒絕呢一個建議。
In British Columbia, an approach to trying to separate people from the illicit drug supply by connecting them with medicated alternatives, pharmaceutical alternatives. And those alternatives might be programs that use drugs like methadone or Suboxone, which are very long-acting opioids. And the intention of those drugs is to try to help people stabilize their lives so that they can you know, move through the stages of, you know, recovery from addiction. There are also, before we get to that point, what has been called safer supply alternatives, which just means that they're pharmaceutical equivalents to the drugs that people would be getting through the illicit drug market, but we know that they're not poisoned, and so those programs are, you know, people need to be under the care of a doctor. They need to be prescribed those medications. In some cases, they may need to come to a clinic or a pharmacy on a regular basis to receive their treatment. And though that is the program that we are really focusing on scaling up.
卑斯綠黨黨領 Sonia Fairchild 話：用刑事法嘅角度去看待藥物危機唔太合理，並唔能夠解決過量同埋成癮嘅問題。
We know from history that approaching a drug crisis, approaching drug use from a criminalized point of view does not solve the problem of drug use in our communities. It doesn't solve the problem of overdose and addiction. Recognizing that addiction is very much connected to health and mental health, and looking at ways that we can, as a society and as government, provide the supports that are essential for people to be well and to, you know, to really find themselves in a better place. The use of police in response to a public health crisis just doesn't make a lot of sense. And again, the police themselves have called for better harm reduction, better access to services, better preventative services. We've called it, for example, for covering psychologists under MSP so that people have access to mental health care before they're in a crisis. And we know that there is a connection between a mental health crisis and drug use. We know that there's a connection between poverty and homelessness and drug use. And I think we have to look at the big picture and what are the things that we can solve as a society and as a government.
一年嚟，社會上仍然有唔少嘅團體就豁免對藏有少量毒品提出起訴嘅做法啦，存在唔同嘅睇法。咁有人就認為政府當局作出嘅修訂係走回頭路，而有關嘅豁免期就仲有2年，唔係未來嘅工作應該點樣籌劃啦？我哋下一節翻嚟再睇。歡迎翻嚟節目時間。卑斯省府喺2016年宣布毒品危機進入醫療緊急狀態之後啦，咁已經係超過13200人因為吸毒過量而死亡。咁吸毒年輕化嘅趨勢咧，亦都較為明顯。當局應該需要為下一代做啲乜嘢啦？而政策喺未來嘅2年又應該點樣繼續實施啦？
年僅只有21歲嘅 Ola Bailey 曾經同海洛因成癮搏鬥，並且因為服用咗含有芬太奴嘅海洛因，最終不幸喺2015年12月去世。Ola 嘅媽媽 Deborah Bailey 喺 Ola 離世之後，積極參與同藥物成癮相關嘅倡導工作。
Unfortunately, in 2015, actually December 22nd, 2015, my daughter Ola lost her battle with addiction and she succumbed to an overdose. And, you know, before that, I had seen all the systemic barriers that were put it kind of in front of someone who's trying to get better from addiction. And after she died, I became just really agitated and angry and wanted to help to do some changes so that people, you know, addiction was treated better. And when I went to see the then head of the Vancouver Coastal Health, he said to me very apologetically, well, you know, we don't have an addiction system that we can fix. We just don't have one. We have to rebuild it. And so I started my advocacy then and I've stayed in it ever since. It's been slow going.
Ola 喺呢幾年積極參與社區活動，宣傳有關工作。佢認為倡導工作嘅能力範圍有限，佢希望社會唔同持份者可以參與其中，而得到政府嘅幫助，將會有效提升倡導工作。
We have no power. We have zero power, just influence. It's actually, when we keep talking about the government, people sometimes say we can't expect the government to do it all. We don't, but the government is the only one that has the power to make the changes. So we find it frustrating sometimes at the slow pace of the government. I take in all of the British Columbia memberships for Mom Stop the Harm. So I read all of the applications, and it's with considerable sorrow that I read the applications where things are still happening that were happening 8 years ago to my daughter. Still difficulty getting into detox or getting from detox to treatment, or difficulty staying on some of the OAT over, you know, opioid agonist treatments. Difficulty with physicians because the BC College of Physicians and Surgeons say they're supportive, but really, you know, they're doing a lot of self-protection themselves.
Deborah 話：政府當局而家做嘅一切仍然未夠。根據卑斯省府數字顯示，省內吸毒過量死亡人數一直有年輕化趨勢。從2020年去到舊年，0至到29歲嘅群組錄得死亡人數都超過300人。
We are absolutely failing on drug prevention and education. You know, I cannot tell you when I've ever seen a drug prevention poster or any kind of literature in public that said drug use is harmful to your health at all in this province. And I think back to COVID, which was also a public health emergency. And, you know, we saw all kinds of signs that told us to stand 6 feet apart, wash your hands. And, you know, it was really helpful because people got those messages and it was really ingrained in us about how to keep ourselves safe during the pandemic. And we need that same kind of effort and emphasis on safety to be put into drug prevention. We need to let people know that, you know what, even drugs that are prescribed can kill you. You can become addicted to them and you can die from taking them. And those are important messages. And it's certainly a message that's not being translated to the public at this time.
毒品應該刑事化，抑或非刑事化？社會上仍然有好多討論。聯邦保守黨黨領博勵治一直揚言，如果成為總理之後，將會廢除現有喺卑斯省少量毒品非刑事化政策。有團體擔心，一旦將政策轉變，將會令卑斯省由零開始。
The way we have tried decriminalization and the way the Liberal government has tried decriminalization was never going to be effective because it wasn't done in the correct way. They did not listen to people who use drugs and drug policy people, and they made mistakes. If it had been done in a different way, I think we would see greater results. So I think the concept and the idea of prohibition is a good thing, of decriminalization is a good thing, but it has to be done in the right way. The idea that we are going to cancel this experiment after 10 months, what is the alternative? I would question Pierre Poilievre, what is the alternative? Is it more police? Is it more cracking down on drugs at borders? He talks about trying to stop drugs coming in. We've been trying to stop drugs for 120 years. It has not worked. It has only made more dangerous drugs. He does talk about increasing treatment, and we can always talk about trying to get people more treatment, but again, that needs to be evidence-based treatment. It needs to be voluntary. It needs to respect human rights, and it needs to be evidence-based.
卑斯社工協會主席 Michael Crawford 認為，每當一個政策有兩極化嘅反應時候，好多時候都會係一種姿態。
I think there are political parties across the country, federally and provincially across the country, that take a moral position. And it's like Nancy Reagan's old slogan in the United States, just say no to drugs. Well, if it were that simple, there wouldn't be much of a drug supply. We would cut down drastically on drug deaths. It's not that simple. People have addictions. We either decide to help them stay alive while they struggle with that addiction. We offer them opportunities to stay out of trouble, to stay out of jail because they're not having to break the law to raise money. It's seeing drug use as a medical problem rather than a moral failing. And once we've done that, we then will commit once we've done that fully, we then as a society will commit ourselves to the kind of programs that keep people alive and put them into positions where they're able to make good decisions about whether they stop the drug, get into treatment, and get into ongoing support.
不過，卑斯聯合黨省議員 Eleanor Sturkle 唔認同工作將會由零開始，只要修訂刑事法例，相信未來工作將會變得更加順利。
I think it's important for people to understand what decriminalization is. No new laws were written in order for us to do this pilot. What decriminalization actually means is that we got permission to just ignore part of Canada's criminal code, the part of the Controlled Drugs and Substances Act. So that means that police don't pay attention to those laws under certain circumstances. And those circumstances are 2.5 grams or less of certain drugs in BC. But when we remove the decriminalization exemption, it just means we go back to the law as it was, and police then are able to continue using the full scope of their powers. So nothing would have to be changed other than the fact that we say now it is illegal again to do this, and there will be consequences for that. So there's no legislation. It just means that the part of the law that police have been allowed now or asked to ignore, we will ask them not to ignore it anymore.
無論點樣，政策仍然實施當中。卑斯精神健康及僻隱廳長話，當局仍然有好多工作仍然進行當中。佢亦都希望仲有2年嘅試驗計劃，卑斯省精神健康問題將會得到改善。
There's lots of work associated with decriminalization, just to continue the work around education, around helping people to understand the impact of stigma. We are building more access to more treatment. Every day we are investing in upstream services because we know how important it is for children and youth to be able to connect with them and to be able to provide mental health services to them sooner, so that small problems that they experience when they're young don't grow into larger problems that might lead to addiction issues. So we are, we've opened up many foundry sites, which are primary and mental health care for kids, that they can access really easily. We are working with the school system to build integrated child and youth mental health teams, which pull clinicians together and counselors together from our health system, our education system, to work with kids really where they're at and wrap supports around them. We are building out our services through hospitals to better support children and youth. That's a big part of the work that we're doing, and we are we're going to be launching we're going to be talking to families and kids more directly and encouraging. We'll have a campaign that will really encourage conversations and encourage families to reach out if they have concerns or questions about the mental health or the substance use that their children may be engaged in.
好啦，今集嘅節目時間就差唔多啦。咁如果觀眾對我哋嘅節目有啲乜嘢意見嘅話，係好歡迎大家以電郵嘅方式同我哋聯絡㗎。我哋嘅電郵地址係mag26@fairchildtv.com。咁如果觀眾想上網重溫今集嘅節目，亦都可以上到去我哋嘅網站3w.fairchildtv.com，點擊節目重溫一欄就可以睇得返㗎啦。再會。